To the Honourable Leader of the Opposition.
Thank you, Mr Speaker, and my question is to the Prime Minister. Prime Minister, how many Australians today are using their credit card to see a GP?
I give the call to the Prime Minister.
Thank you. The answer to that, Mr Speaker, is because of those opposite and their undermining of the health system. Too many is the answer. Too many. Which is why we want 90% by 2030 to just use this little card here. This little card here. This little piece.
Order.
This piece of green and gold plastic, Mr Speaker.
Well, point of order on the use of props. You've been very strict on this side of the House. He's missing one of his props. He didn't bring up the credit card as well.
The meeting will continue with his answer.
I will, Mr Speaker, because it's valuable. It's valuable. And everyone on this side of the House values their Medicare card. And I'll tell you what, Mr Speaker, every Australian values their Medicare card as well, except perhaps some of those over there. Except perhaps some of them over there. Now, you can imagine the Tactics Committee meeting this morning, Mr Speaker, sitting around and going, I know where they're vulnerable, Medicare. We think there's a bit of doubt out there in the community, Mr Speaker, about their attitude towards public health care, because they never want to talk about it. They never raise it. I mean, has the Prime Minister got a Medicare card? So that's why I brought it in, to confirm that that's the case, Mr Speaker. But I tell you what, the 1.5 million Australians who've been to the not 50 but 87 urgent care clinics, all they have needed is their Medicare card. And one third of those have been under the age of 15.
On relevance, Mr Speaker, it was a very tight question. How many Australians today are using their credit card to see a doctor? Perhaps the Prime Minister could undertake to come back with those figures if he doesn't have them. But he does need to acknowledge the time.
Thanks, Mr Speaker. And I am giving some numbers here to assist the opposition. 1.5 million. That's the number of Australians who've been to Medicare urgent care clinics. 94. That's the number that support Medicare urgent care clinics. 27 million. That is the number of Australians who support Medicare. All of us here who support bulk billing. The truth is, at the election campaign, like at other times, we have campaigned to strengthen Medicare. That is what we have done since we came into office in 2022. Those opposite, when they came into office, the last time government changed, and we have no doubt that the same thing would have occurred as well, we had an attempt to introduce a Medicare co-payment and abolish bulk billing altogether. We had $50 billion ripped out of the public hospital system. We had a failure to train enough GPs. We had a complete failure when it comes to aged care, summed up by that one word of neglect. We on this side of the chamber are very proud that Labor created Medicare, will strengthen Medicare, and that's what we do each and every day. And in the legislation that we've had, of course, been talking about this week for cheaper medicines, that's a part of our strengthening Medicare.